Hello friends, welcome to Fast Coder 21 free medical coding YouTube channel. As October 1st, 2023 is around the corner, as a medical coder, we need to know latest ICD-10 CM guideline changes as well as the new and revised and deleted ICD-10 CM codes. So in this session, we are going to learn ICD-10 CM 2024 guidelines and code changes, including CCs and MCCs. If we check new updates, total we have 395 codes and revised 13 codes and deleted 25 codes. So this is the distribution of the codes. Here we have most of the additions in external cause of morbidity. Next comes disease of skin and subcutaneous tissue. Next comes disease of the eye and adnexa. And we have few chapters like mental, behavioral and neurodevelopment disorder. In those chapters, there are no changes and there are no additions. So first convention change is etiology manifestation convention. So conventions for the ICD-10 CM. So previously we don't have this A code from category G20 in the ICD-10 CM guidelines. So they have added now. So whenever we code Parkinson disease along with dementia, we need to code Parkinson disease first, then we need to code dementia code like F02.80 or F02.81. So there is a change for general guidelines SDOH. So basically current October 1st onwards, all SDOH codes are included in the chapter 21. The guideline is same, just they have added the extra words here. So for sepsis following a post-procedural wound infection, we need to code T81.41 to T81.43 infection following a procedure or code from 0.086 00 to 08603 infection of obstetrical surgical wound that identifies the site of the infection should be sequenced first if known. So basically here we need to understand that if the patient has sepsis following a post-procedural wound infection, we need to code T81.41 to T81.43 as the first listed diagnosis. And also we need to assign additional code for sepsis following a procedure T81.44 or sepsis following an obstetrical procedure O86.04. If the patient has severe sepsis, the appropriate code from subcategory R65 should be R65.2 should be also assigned with the additional codes for any acute organ dysfunction. So basically, whenever patient has post-procedural wound infection, so because of that post-procedural wound infection, if the patient has sepsis, we need to code the site of the infection as the sequenced first. Then we need to assign sepsis additional code. In new guidelines, they have added here chapter 1 certain infectious and parasitic diseases. So they have added A41.54 sepsis due to Acinetobacter baumannii. So this is a MCC code for 2024. So next one, chapter 1 certain infectious and parasitic diseases. Previously, if the patient comes in for preoperative testing, we need to assign Z11.52. As the COVID pandemic is ended now, so they have replaced Z11.52 with Z11.59 encounter for screening for other viral diseases for COVID-19 screening encounter on or after October 1st, 2023 assigned code Z11.52. So if the patient is coming for screening, we need to assign encounter for screening for other viral diseases. So next one is for chapter 2 neoplasm code changes. So here they have added the word familial adenomatous polyposis in the table of neoplasm. D13.9 is revised to D13.99 for benign neoplasm of ill-defined sites within the digestive system and familial adenomatous polyposis. So D13.9 is 13.9 is the category and D13.99 and D13.99 are the subcategories. So they have added in the new guidelines on new codes. And also we have new Z codes for FAP, for family history of FAP. familial adenomatous polyposis. And also in new chapter, we have desmite tumor. So this is the new codes in 2024. Next, if we check chapter 3, disease of the blood and blood forming. So there are new codes for reporting Schwann-Diamond syndrome, D61.02 and IgG4 related disease and many parenthetical revisions here. So here this category is new MCC and new CC. So they have added this one also IgG4 related disease D89.84 IgG4 related disease immunoglobulin G4 related disease. So next one is for autosomal dominant hypocalcemia ADH. So a new subcategory houses several new codes to identify individuals with ADH. So this is the new subcategory E20.810 for autosomal dominant hypocalcemia. Here we have two types, type 1 and type 2. So these autosomal type 1 and type 2 both are included in the autosomal dominant hypocalcemia. If it is applicable, we need to code calculus of kidney, chronic kidney disease, respiratory distress or seizure disorder. Next one is lysosome associated membrane protein 2 deficiency LAMP2. So here they have added E74.05 lysosome associated membrane protein 2 deficiency. Usually we will call it as Denon disease. So here if it is possible or applicable, we need to code dilated cardiomyopathy and obstructive hypertrophic cardiomyopathy. So this E74.05 lysosome associated membrane protein 2 LAMP2 deficiency is the new CC. Next, if we check chapter 4 endocrine disorders, metabolic disorders, E88.8 other specified metabolic disorders, and they have expanded this subcategory to E88.810, 811, 818 and 819. So this E88.8 subcategory is completely new CC for inpatient coders. Next, we have wasting disease code. So usually we'll call it as wasting syndrome also. This is a new code. Code is E88.A wasting disease due to underlying condition, cachexia due to underlying condition. So basically here we need to code the underlying condition first. Next one is for chapter 6, disease of nervous system, chronic migraine. So chronic migraine is a condition where you have frequent or long lasting episodes of headaches and migraines. So if the patient has any type of migraine which is frequent and long lasting, we need to consider it as chronic migraine. So this year they have added excludes one for chronic migraine with aura. So exclude one migraine with aura G43.1. So endo G43.E0 and G43.E1 are the new subcategories included in this year. So chronic migraine with aura not intractable, chronic migraine with aura intractable. So next we have few addition of codes in chapter 7, disease of eye and adnexa. So basically these codes are for strabismus. So several new subcategories and codes for reporting extraocular muscle entrapment are being added under H50 other strabismus. So here our category is H50 other strabismus. So under this strabismus we have multiple subcategories. So if we check those subcategories, H50.621 in inferior oblique muscle entrapment right eye, H50649 lateral rectus muscle entrapment unspecified eye, H50662 superior oblique muscle entrapment left eye, H50651 medial rectus muscle entrapment. As all of us know, in the eye we have multiple horizontal and vertical muscles. So based on those muscle condition, we have new codes provided in this year. So we have chapter 7 disease of eye and adnexa. We have few codes added for sickle cell retinopathy here. So here H36.8 is the category where we have H36.81, 82 and 89 are the new codes added in this year. And in the same disease of eye and adnexa, we have few new codes added under H54. So which includes revised this code H54 by 54.511 low vision right eye category 1 to 2, H54.511 low vision right eye category 1. So they have deleted H54.512A and they have added H54.512 low vision right eye category 2 and H54.512A low vision right eye category 2 normal vision left eye. So it is directly visible. Here there is no change. These two codes are revised and one is deleted here. Two are added for this year. So if you check in the H57 other disorder of eye and adnexa, so there is no change in the category level. So they have added few codes under the subcategory level. So they have H57.8A, 8A1, 8A2, 8A3, 8A9 based on the foreign body sensation right eye, left eye, bilateral eyes and unspecified eye. So next most important changes, chapter 9, disease of the circulatory system. So here they have added hypertension resistance. So here we need to assign code I1A.0 for resistant hypertension as additional code when apparent treatment resistant hypertension, treatment resistant hypertension or true resistant hypertension is documented by the provider. So a code for the specific type of existing hypertension is sequenced first if known. So for example, if the patient has hypertension as well as the resistant hypertension, so we need to code I10 as the first code. Next we need to code I1A.0 resistant hypertension additionally. So if we check here, these I1A all category codes are added here. If you check this subcategory I1A.0 resistant hypertension, so these all are new codes. We need to code from October 1st, 2023. See here code first. For example, patient has secondary hypertension. We need to code I15 category first. Then we need to code I1A.0 category next. So next one is for chapter 9. These are the circulatory system. Here we need to check angina. So angina is a common ailment that is often dismissed, but the patients with angina often experience coronary macrovascular dysfunction. So based on this coronary macrovascular dysfunction, we have multiple codes here. This condition is associated with significantly higher rates of major adverse cardiac events. So here previously we have I20 category angina pectoris. So now they have added few codes here. So angina equivalent, angina of effort, to all these are deleted and they have added new subcategory I20.81 angina pectoris with coronary macrovascular dysfunction and I20.89 other forms of angina pectoris. So if we check the CMS types of angina, so this is the normal coronary artery. So if you want to consider it as a stable angina, so it must be have atherosclerosis. If it is unstable angina, patient will have atherosclerosis with blood clot. If it is variant angina, this is coronary bypass. It is complete coronary system obstruction. So if we want to consider variant angina, we need to check the documentation for coronary spasm. So if the patient has coronary spasm, we need to consider it as variant angina. So next one is chapter 9. This is our circulatory system. As usual, coronary micro CMD is a condition that impacts the microvascular system by restricting microvascular flow and increasing microvascular resistance. So here also there is no change in this category. So there are new additions added in this category. Here we have one subcategory I21.B myocardial infarction with coronary macrovascular dysfunction. So here we have one more code, new code, inappropriate sinus tachycardia. We will call it as IST. So IST is a clinical syndrome characterized by a sinus heart rate inexplicably higher than 100 beats per minute at rest that is associated with symptoms like palpitation, dyspnea or dizziness in the absence of primary cause of tachycardia. So basically, as all of us know, tachycardia means like faster heart rate which is higher than the 100 beats per minute. So here they have deleted under I47.1 category like atrial, these all the codes are deleted and they have added new subcategory I47.1011 and 19 for supraventricular tachycardia unspecified, inappropriate sinus tachycardia so stated, other supraventricular tachycardia. So these are the subcategories newly added. And this is chapter 10. This is of the respiratory system. If we check obliterative bronchiolitis codes. So here these all are new codes. So we need to remember. Here J44.8 other specified chronic obstructive pulmonary disease. So whenever we see bronchiolitis obliterans and bronchiolitis obliterans syndrome, so we need to code J44.81 subcategory. So next one is for bacterial pneumonia. If the bacteria goes into your lungs, the air sacs in your lungs get infected and inflamed. They fill up with fluid and that causes pneumonia. So basically whenever there is bacteria in our lungs, so lungs get infected and inflamed. So because of that inflammation, we will get pneumonia. So there is no change in the category level here. J15 bacterial pneumonia not elsewhere classified, but they have added few subcategories here. J15.61 pneumonia due to Acinetobacter baumannii, J1569 pneumonia due to other gram-negative bacteria. So basically, this subcategory is new MCCs from October 1st, 2023. So this is the new MCC. So October 1st onwards, in this of the digestive system, we are going to see new codes added for appendicitis. So these are the new codes here. So they have added new subcategory K35.200, K35.201, K35.201 for acute appendicitis with generalized peritonitis without perforation or abscess, K35.201 acute appendicitis with generalized peritonitis with perforation without abscess. So first one is without perforation as abscess and this one is with perforation without abscess. If you see next one without abscess, unspecified as to perforation. So these are all new CCs for inpatient coders. And also we have K35.221 subcategory is added, K35.210, 211, 219. All these subcategories are new MCC now. So what are these? These also like without perforation and without abscess. So with perforation, appendix with abscess and other codes. So next we have one new code here, retroperitoneal fibrosis. So what is retroperitoneal fibrosis? Which is a disorder in which inflammation and extensive scar tissue occur in the back of the abdominal cavity behind retro. So we need to understand retro means behind the membrane that surrounds the organs of the digestive system, the peritoneum. This area is known as retroperitoneal space. So basically behind the abdominal cavity is the retro and near digestive system it is the peritoneum. So here they have added two codes K68.2 retroperitoneal fibrosis. If it is applicable we need to code associated obstruction of the ureter. So now K68.2 is a new MCC for inpatient coders. Next we have retroperitoneal hematoma. So retroperitoneal hematoma is defined as bleeding into the retroperitoneal space. As we have discussed, retroperitoneal space is the space back of the abdominal cavity and the membrane that surrounds the organs of the digestive system, which is the peritoneum. So hematoma of the retroperitoneal area is known as retroperitoneal hematoma. So they have added one code here K68.3. So next we have from digestive system short bowel syndrome. So short bowel syndrome is a condition in which your body is unable to absorb enough nutrients from the foods you eat because you don't have enough small intestine. So it is basically lack of the small intestine. So that's why its name itself short bowel syndrome, as la small intestine is very small. So you can't absorb the more nutrients. So here they have added few codes here. So for categories not changed K90.8. So they have added new subcategory codes K90.82 short bowel syndrome, short gut syndrome, and K90, 821, 822, 829, 821 is short bowel syndrome with colon in continuity. Next one is 822 short bowel syndrome without colon in continuity, 829 short bowel syndrome unspecified. So basically this K90.8 category is new CC now for inpatient coders. So next one is intestinal failure. So what is intestinal failure? Is the inability to of the gut to absorb necessary water, macronutrients and electrolytes sufficient to sustain life and requiring intravenous supplementation or replacement. So they have added this code K90.83 intestinal failure. So this is also new SEC for inpatient coders. So these are the symptoms: intestinal failure, so loss of absorbed area, intact absorbed area. Next, we have major additions in chapter 13. This is the musculoskeletal system. So basically here they have added few codes for osteoporosis. So osteoporosis, as all of us know, it is a softening of the bone. So osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases, or when the quality or structure of the bone changes. So this can lead to decrease in bone strength that can increase the risk of broken bones. So this here normal mode, this one, bones with osteoporosis. So osteo means bone, porosis means pores here. So because of these pores, bone will get like less density and vulnerable to the fractures. So we have nearly 42 new codes to help further define osteoporosis with pathologic fracture, M80, 8B2P, B9D, B19, B2B. So based on the osteoporosis with current pathologic fracture. So these all are new CC from October 1st, 2023 for inpatient coders. Next one added is immunoglobulin A nephropathy, IgAN. So IgA nephropathy, also known as Berger disease, is a kidney disease. So it happens when a germ fighting protein called immunoglobulin A builds up in the kidneys. So okay, this causes a type of swelling called inflammation that over time can make it harder for the kidneys to filter waste from the blood. So basically, because of this IgAN, kidneys unable to act what which would like to act. Because of this disease, swelling called inflammation that over time can make it harder for the kidneys to filter waste from the blood. So it will create inflammation on the kidney. So they have added few subcategories here. New NO2, B1, B2, B3, B4, B5, B6. So these all are new CCs for inpatient coders. So if we check N02.B1, recurrent and persistent immunoglobulin A nephropathy, glomerular lesion. So this one is with focal and segmental glomerular lesion, diffuse membranoproliferative glomerulonephritis. So diffuse membranous glomerulonephritis. So like that they have added in this year. So next they have added membranous nephropathy. So also known as membranous glomerulopathy is one of the many glomerular disease causing nephrotic syndrome. So it is characterized by massive proteinuria, and what is proteinuria? Proteins on the in the urea and in the urine, and clinically presents with peripheral edema, hypertension, proteurine and manifestation of thromboembolic pneumonia. Next one is nephrotic syndrome. So nephrotic is a group of symptoms that indicate the kidneys are not working properly. So these are the symptoms for that one. So these are the new codes. So these all are new CCs for inpatient coders. So the N04.2 categories are divided into four subcategories: N0.20 nephrosis in diffuse membranous glomerulonephritis. So all these are subcategories of N04.2. So next one is isolated proteinuria. So isolated proteinuria is a proteinuria without any abnormalities in urine sediment, hematuria or reduction in GFR, and in the absence of hypertension and diabetes. So they have added few codes here for proteinuria. So N06.20, 21, 22 and 29. So these all are so far new MCs for inpatient coders.